everyone, so let's move towards our today's topic, which is
We have already discussed about the pons and the medulla and the parts of the brainstem basically. So we know that the lowest part is which is directly connected with the spinal cord is medulla oblongata. Then above that pons is present, and the uppermost part of the brainstem and the smallest part of the brainstem is called as midbrain. So today we will gonna talk about this brainstem. Brainstem is also known as mesencephalon, and it consists of the nuclei of third and the fourth cranial nerve. We have discussed in the lecture of the medulla that medulla consists of cranial nerve number nuclei of cranial nerve number 12, 11, 10, 9, and yes, these four cranial nerve, the nuclei of these four cranial nerve are present in the medulla. Then we have discussed in the topic of pons that in pons the nuclei of cranial nerve are present, and those are 8, 7, 6 and 5. And then afterwards in this midbrain, the nuclei of the cranial nerve, and those cranial nerve are third and the fourth cranial nerve. So the nuclei of the third and the fourth cranial nerve are present in this midbrain. The cavity of the midbrain is called as Sylvian duct, or you can say that cerebral aqueduct, and this cerebral aqueduct connects the lateral third ventricle and the fourth ventricle. What is third and the fourth ventricle? Ventricles are basically the cavity of the brains in which CSF is like producing and they are flowing. So we have discussed in the separate lecture, you can watch that lecture, but in this lecture, like I said, we are particularly talking about the midbrain. Now the midbrain consists of two parts. Okay, if you see the midbrain from above, in center there is a cavity of midbrain called as cerebral aqueduct. Anterior part is called as tectum, and anterior part is called as cerebral peduncle, and posterior part is called as tectum. Okay, anteriorly cerebral peduncles are present, which connects the midbrain with the cerebellum, and cerebral peduncles we all know that, and tectum. The main part of the midbrain is tectum, which is present posteriorly. Basically on the posterior side of the midbrain, or on the tectum part, there are four swellings. The upper two swellings are called as superior colliculi, and the inferior two swellings are called as inferior colliculi. These colliculi consist of fibers. The superior colliculi consist of fibers which help in vision. The inferior colliculi consist of fibers which help in listening, which help in hearing process. Okay, so these are the very much important topic. Anteriorly, if I talk about the peduncle side, the nerve which arises, that is called as oculomotor nerve, and posteriorly trochlear nerve arises. Okay, and trochlear nerve, the most important thing and the most common question which is asked by the professor is the nerve which is the only nerve which passes from the posterior side of the brainstem is dash. So you will answer that trochlear nerve is the nerve which passes from the posterior side of the brainstem, and it is the only nerve which passes from the posterior side of the brainstem. Okay, so this was the whole topic. Now moving further, blood supply of the midbrain. The blood supply is through basilar artery, superior communicating artery, posterior cerebral artery, and superior cerebellar arteries. Okay, so this was the whole topic regarding midbrain. Till then, work hard, study hard, and good luck. Take care. Bye bye. Thank you so much. Take care.